Well, as long as you breathe in and out, just seeking solutions. The World Health Organization tells us that about 19,000 number, and we'll be trying to really understand how can we reduce this number from tens that are around you. If you're in the house right now, if you're watching us in the house, kind of pollutants from the house as you live, but as soon actually cause you also lead to some of these pollutants and the kind of effects that are seen. And to help us have this conversation, Dr. Joaquim Nyamari is an environmental health expert as well as a health member, Nairobi Air Quality Working Group. Karibuni sana. Well, as I say, ladies first, I'll start with you, Madam Mugo. Brief introduction of you. And what really is Nairobi Air Quality Working Group?
Is about bringing multi-sectoral, multidisciplinary and stakeholders together as we address the issues of air quality in Nairobi. Talking about multidisciplinary is a lot of expertise from different sectors. So for this working group, it brings together the academia, it brings together researchers, together civil society, and we are coming together, each one of us in our expertise, trying to bring to the table to have a good quality of air. The pollutants that make us now start talking of the working group, and maybe Dr. would add.
I actually just wanted him to add on the same, even as
the city of Nairobi.
Right.
And this Nairobi Air Catalyst is a project under the World Resource Institute, whose major objective is actually to try and come up using air pollutants within the city of Nairobi. As you, that's almost around 13,300 deaths that can be attributed, and these percentages could actually be higher because there are a lot that go unreported. And of course, for every death that occurs, it means there are a vast, or rather, so many diseases, morbidities that the healthcare system is overburdened with.
Right.
So by coming together through various stakeholders within the city of Nairobi, we want that are attributed to air pollution.
Why Nairobi?
Actually, WHO reports 19,000, but then there is another organization, Global Air, that reports actually over 23,000 deaths. And then the percentage, 70% of those deaths are attributed to 70% of those deaths actually occur in the city of Nairobi.
Is it a number of industries, it's urbanization that really leads to this?
Yeah, actually the levels of the development for in almost every African country is quite rapid, and amongst them being the contamination of the air that we breathe. It's not only Nairobi that we have these issues of air pollution, but then we want to create a benchmark that can inform policy and strategies for controlling air pollution.
As a working group, even for the 3 years, I'm pretty sure you've done a mapping of different cities even in Kenya. How is the situation like? He's mentioned Nairobi getting a high percentage, but how is the mapping like in other places in the country?
First to mention that we have first concentrated with Nairobi.
Okay.
And for that reason, the mapping that we have done mostly in Nairobi, and that is by assistance of this. And for those ones, they have helped us within the committee to be able to put sensors within our city. So for now, what we can clearly talk about are what are within our city.
Within Nairobi.
Within Nairobi, we have sensors within several parts of our city, and those were based on other researches that had been done earlier on by other organizations, so that here we are suspecting they put sensors, and as we continue with the discussion, we'll be sharing areas that we are already seeing that the air quality is.
That was my next question. Areas now specifically in Nairobi. because Nairobi has different constituents. And residents of Nairobi are listening to both of you this morning, and they're wondering, where I live in Nairobi, is there too much air pollution, or it's actually on a lower scale? Because when you take a look at Nairobi, is one of those places that there's certain, it's quite dense. Do some of these factors play in, Dr. when you, get into somewhere like, let's say, Pipeline, there's so much population around this area. Some of these pollutants that I know you'd now be mentioning, dust station is consuming these pollutants. When you go to other areas, the population is low. Do some of these factors play in? Yeah,
I'll first want to start by mentioning that, air moves to another. In fact, you realize that massive amounts of polluted air in Nairobi move to the Nyanza region. So there's a likelihood that these can affect people elsewhere and not necessarily within the city of Nairobi. Coming to the next question, in the industrial areas or industries going to where human settlements are.
Places like, let's say, Athi River and Kitengela, there's so many.
Mavoko, there is a lot of human industrial areas. And,
the whole manufacturing of cement and
exactly. That predisposes the populace to very high levels of these pollutants. And of course, the proxy disposes people to the same different sources of energy. Some of them that are very crude, that predispose them to dangers. You are likely to find the air quality in densely populated areas like what you mentioned in Pipeline, in some slum areas, and are likely to predispose people. But not only that, the studies that have been done show that the major culprits also of air pollution in Nairobi are actually hospitals, because staying next to some of these facilities are likely to be predisposed to very high levels of this. Another major source is vehicle emissions. The vehicle volumes is increasing in Kenya, and of course that is one of the major aspects. One motorcycle pollutes more than 10 cars. So the more we have these motorable likely to be polluted more and more. And at the end of the day, more health effects as a result of the same. So we need to come up with very effective strategies that can reduce these air pollutants within our environment.
And you mentioned that all this boils down to improper, because when you take a look at, let's say, this populace living around Mavoko, Athi River, where there is quite a number of stages that are setting, are they not knee-jerk reactions to whatever problems have been caused are right now, Madam Mugo?
I think it's unplanned, and that is the situation that we find ourselves in. So for us now is finding strategies of how to deal with this, and some of these strategies are informing policy. You remember that when we were talking about issues of air pollution, emphasizing a lot on communicable diseases and not on non-communicable diseases. And for that reason, for the longest time, we talked about diseases which were communicating our populations suffering from non-communicable diseases, which would be a result of air pollution. And for that reason, now we are shifting mind and concentrating on issues of air quality. Much segments are there. So for us, one is trying within these with policies. Definitely there are policies which are there. But apart from that, we are also having within us working with populations, because some things are also behavioral. And not every other thing within what you are dealing with is the structure. There are behavioral things out. Because when you talk about air quality, there is the ambient air and there is the indoor that would issue of behavior change. What do our populations know? Are they even aware that our air quality is not good? And if it's not good, am I still using a GOtv? That is a behavior thing that can be addressed by behavior change, which will start with awareness creation. For us as Kenyans, there is this behavior, like each one of us, and when you look even in the car, you will see that it's only carrying one or two, maybe remove most of the vehicles from the city. But then, apart from policy, what is our behavior? Are we convinced that we want to get into a public vehicle and go to town, like what we see in the developed countries? So there are all these other strategies that we think structures. There are also many other things that we can still do, even in the situation that we find. Advocacy, awareness, and those are some of the things that we are concentrating on.
Right. But Daktari, some of these things seem very subtle around where we are. Kama tu ya Nduthi, for example, ya motorcycle. When you talk about the kind of air pollutants and air pollution it actually causes, when you're walking, a versatility in it is very huge. You can't actually see, kama, let's say, for example, let's say water pollution, for example, you can actually see, this is there's pollution in our rivers and all that. Air pollution, there's a lot of versatility in it. How can you convince?
Like what my colleague has said, we want to concentrate so much on public awareness so that people can know. There are some air pollutants that are actually, we call them more organoleptic. Some contaminants you may or another.
So are they, do we commonly interact with them?
Yeah, we carbon monoxide.
Oh, okay.
We have nitric oxides, sulfur dioxides. Those are some of the major ozone, which you can't really actually smell, amongst others. These are pollutants that people are not really aware of. And when it comes to, for example, diseases like non-communicable diseases, you will realize that air pollution is actually the second most leading risk factor to non-communicable diseases. But our populace is not aware of it. That is, of course, amongst other things that you can actually see, they're tangible. But the air pollution is often ignored. So enhancing public awareness about these air pollutants is very, very important, especially when it comes to indoor air pollution. The type of sources of energy that our people use, which house do you stay in, which parts of the city are likely to be polluted than others, and what should we do about it when it comes to policy. How should we policies? We have very, very good existing policies, but often there is a direction where we can enhance community and public awareness, mobilize them, and they are able to tell what is good for them vis-a-vis what is not good for them. We've had some communities, for example, in the areas you mentioned, standing up against the construct. We also want a very strengthened National Environmental Management Authority that is able to stop some projects or some industries from being constructed in residential industrial areas. So it's quite a very broad, we need to take a very broad approach. I know we are crawling, but soon we'll be walking.
Right. I mean, some of these policies, we've had them for a number of times. Whatever you're telling us about Mugo, we've had them for quite a number of times. Acha kutumia jiko, move to something else. So if something else ndio watu wasubuhi wanataka kusikia. What is my solution to this? Because right, sorry for that. Yeah. So a jiko, this person will have to buy charcoal, the makaa yenye amezoea. And one of the solutions we probably tell them is either get a gas stove. So hypothetically speaking, really, and actually even frankly speaking, do some of these solutions that you give people, specifically, let's say even in Nairobi, do they make sense at the end of the day for this person, ule mwananchi wa kawaida, when they're trying to balance and see, yeah, maybe atakwambia, no, for me, jiko is way cheaper.
I hear you loud and clear. And that comes, remember I talked about the fact that we are working with many other civil society organizations that are working within our communities. And from there, that's to adopt a new technology. Usually it's about awareness, it's about convincing them about the cost, the benefit.
Yeah.
And in health, in most cases, the cost is a bit higher, usually when you're starting these technologies. And for that reason, working with these organizations and working even with the health promoters, we are going into communities, we are starting with groups, and within these groups, we are teaching them, we are making them aware of the long-term effects, because most of the health effects of air pollution are not usually instant. Most of them are long-term. So we are teaching them on the missions, like not in this case, we want them to use the cleanest energy possible. But then again, we know that we have to go step by step.
So in a
the organizations in the community which are addressing the issues of GCOs and empowering who are naturally they would be the ones in the kitchen for longer.
Yeah, sure.
And you know that even in our households here there is no kitchen, there is sometimes you know everything is happening in one space.
Yeah.
But the person who is there most zile bed sitter, zile one room.
Yeah.
And the women are there mostly. In fact, researchers show that women are more affected by indoor pollution. So working with them, slowly by slowly, we are convincing them by educating them, by providing the hardware. And in this case, I'm meaning that when we provide GCOs that we think are better in terms of clean energy group, they're able to pool resources together and get even at cheaper rates. So those are some of the things that we are continuing to do within the communities at that level. We are also teaching them, Daktari mentioned about the issue of ventilation.
Before, let's say, move away from GCO, but then you also say some types of GCOs that are designed to have clean energy.
Emit less.
So what other ideal types and forms would situation in Nairobi, and this person probably lives, as you're saying, in a single room or a bed sitter, even as you also come in on matters ventilation. What's the ideal forms that they use on gas?
The issue of air quality or air pollution needs to take an holistic or to prevent somebody from using unclean or a crude source of energy. There's somewhere that maybe I need to make it easy for them. For example, the cost of LPG gas that is clean. And again, sensitizing them to know charcoal is expensive. If you look at the number of, let's say, debes a person is using in a week or in a month, you will actually realize if you put that cost cumulatively using a cylinder or 6 kg cylinder, you will actually realize of the cumulative amount at a time to afford that cylinder at once. For the charcoal, you might afford the gorogoro maybe 300 shillings after every 1 or 2 days within a very short duration of time. So poverty eradication and actually pollutants from use of charcoal amongst other ways. So it's really something that needs to take a strongly holistic approach that looks at several facts within the economy that can encourage the consumption of cleaner energy.
All right. Yep. Now, even as we get in, still on that bit, assumably someone is watching us this morning, what are some of those things that we don't normally do that can also help us have that ideal air quality even at home?
Yeah, you see, I remember maybe this year, it could be last year, but where we had people dying, an entire family dying, I think in Githurai, it enclosed themselves in a house. They were cooking using charcoal, and there was no ventilation, and they all died from asphyxiation. Our community need to know that ventilation is normally very important. What we call in a building, if you have a door, a window this side, you need to have also buildings. And one of the major things that we look at is whether there is a cross ventilation.
And majority don't
but
really have.
Unfortunately, like in some of the estates that you aforementioned before, you realize there is completely no cross ventilation. And as a result of that, any energy, candling, or any form of energy that you use within the house contaminates the air in that building. Not only the air, even the humidity levels are high. So you walk into some of those buildings, you realize that they have molds, and molds that are attributed to high levels of asthma in buildings. So we really need to sensitize our people that before they rent or occupy any house, apartment or buildings, they have to make sure there is some form of ventilation.
Help us understand that cross ventilation aspect here. So does it mean that in front of me?
Not necessarily in front of you, but there must be a window
in
or
the same
opposite,
room. Opposite,
in the same room, that will allow free movement of air. In the ambient air dilutes the concentrations of pollutants in the air, while indoor there is no dilution factor, especially when there is no cross ventilation. That is what we mean by our people knowing the importance of ventilation in buildings. So unfortunately, in most informal settlements, we actually do not have cross ventilations. So our public health professionals or officers who do inspections, and our structural building inspectors, our engineers, should ensure approaching issues or to do with air quality is actually vast and needs to have an holistic approach.
Right.
Yeah.
And well, Madam August, you also sit on the health committee, so help us understand. He had mentioned about asthma, but then there are also other health effects that come with. Tell us about that.
Yeah, maybe before I say that, it's good to mention that even as we speak about laws and policies about even ventilation, it's clearly written that there has to be proper ventilation, inspections have to be done in these buildings, but you and me know that will apply to maybe the commercial buildings, the town, you know, the ones in the city, within the city. And so for those ones within our do about it. So at that point again, we are emphasizing on issues of creation of awareness, so that even just this one opening that I have within my house, am I aware that I am supposed to have it open? Am I aware that if I'm using a jiko, for example, I'm using it at the veranda stove, I could put it off outside. So there are things that we are doing at different levels, depending on who is it that we are addressing, what type of settlements are there. So talking about asthma is the most...
And before you even enter into health effects, something came to my mind on even the whole buildings. Because, I mean, it's one thing to have the cross ventilation for a single building. But then some of these places that I was mentioning, there's quite the population around there. So you'd find about 5 high-rise buildings, how they're constructed, if I live at the very top, or rather, actually, hapo katikati, maybe the 3rd floor, yes, I want to really open my window, but then there isn't enough ventilation, because there are also other buildings. Does this also apply to how buildings are approved? Because it doesn't make sense that buildings are really, there isn't actually less space
of air in those places. Buildings within buildings, and they've caused some canyons that will not allow free movement of air. That is actually one of the major problems we have in Nairobi due to unplanned development. And the more we realize that this is one of the major, we should start having our city planners putting those things into consideration. Yeah, very important. Other than asthma, there are so many health issues that are associated to air pollution. You realize in Kenya, almost every county, respiratory diseases